Okay, so when putting the gait belt on, we want to make sure it's nice and tight so that there's not going to be any slipping of the belt, because if a patient starts falling, it could just slip all the way up to their armpit, and then you're not going to be able to help them keep their balance. So we're going to do a little bit of tandem walking here. So we'll have Michaela walk heel to toe, and I'm going to spot her as little or as much as she needs it. Okay, if she's really unsteady, I'll grab with 2 hands, okay? Yeah, good. Okay, and then if she were to start falling, then a lot of the time I can stabilize them or help her keep her balance. But if she's going all the way down, especially with certain patients, I'm not going to be strong enough to hold them up. So it's more about if she starts falling backwards, for example, then I'm going to kind of help her, yeah, go down, okay, help lower her down, keeping a hold of the belt but minimizing impact. So okay, so we wanted to go over how to put a gait belt on properly. The gait belt has a front and a back. This is the underneath side, this is the outside, and they wrap around a patient so that it comes through the claws first and then back down through. Okay, so we'll put this on Michaela here and show you how to properly put that on a patient. This is so that we can grab a hold on this part. So we'll go ahead and put that on Michaela, around Michaela here. So reaching around the patient, and it goes around their waist, not their chest. It's kind of right along where you would put a belt. It needs to be nice and tight, not super loose. Okay, let's have you turn that way, Michaela. So we go through the claws, and then we go down through here. And we like to have the tail here so that we can grab the tail and make sure it's locked in so there's no slipping on the belt, okay? And then we always keep a hand or 2 on the patient depending on how unstable they are. So then if we start doing balance exercises, I can kind of be the reins to help them keep their balance. 2 hands if they're really unstable, and 1 hand if they just need a little bit of a spot. Okay? All right, so if we have somebody coming in the clinic that's really unstable and they need something to hold on to, you can provide some assistance to them by just giving them an arm or helping them out of a chair, for example. So Michaela here is really unsteady. We're gonna walk over to the total gym. We'll have her stand up. I might need to give her a hand. She's up okay. Okay, and have her grab my arm, and we'll walk on over. And you can provide the amount of support you need. And if you're not strong enough, grab somebody that is. If it's a larger patient, feel free to have somebody grab them and help them over. We also do have a walker in the back or a cane around the clinic if they need something like that. But make sure they have their own assistive device if it is something that they brought to the clinic. So the gait belt properly placed, we're going to do a little bit of balance. Now usually it's a good idea to have a gait belt if they are unsteady on the proper way, tight enough, not too high, not too low, right around the waist. And we'll have Michaela do a little bit of single leg balance, and I can spot her really well with the gait belt. Okay, if she doesn't have a gait belt or I don't have one, I can be right up here by her shoulders, helping stabilize her. If she starts going one way or the other, right, I can be a good support for her. Again, if there are any near falls, we just help them adjust. If they're going down, we always want to help lower them down slowly to the ground so that they can't hurt if we can't help them stay upright all the way.